Systemic mycoses, these are the most dangerous, and most of them are reportable. If you hear of a patient coming in and you diagnose it with some of these, you need to report them to the CDC. Of course, Candida albicans is not one of those, so don't freak out when you see that as a normal systemic infection. But some of the treatments include amphotericin B, or as the nurses call it, amphoterrible B. It can be a horrible disease. They are mostly dimorphic. They cause a lot of lung infections. They're frequently fatal, and they have symptoms similar to TB, so a lot of times they're misdiagnosed to begin with. If you have people that are around bird droppings or fecal droppings, if they're trying to clean up old sheds, if they've been working around birds of any kind, then those are indications that they may have one of these systemic mycoses. Histoplasmosis is found sometimes if people keep the pigeons where they do the pigeon races. That can be a source of it, anywhere they're having to deal with fecal material. A simple paper mask would help reduce the chance of getting these infections. Coccidiomycoses you normally find in Arizona out to California. But you do see it sometimes in the lower Mississippi Valley and even into Louisiana after Hurricane Katrina. Coccidiomycoses, there were a few cases of it, came through the laboratories in the hospitals there. Candida albicans, normal mouth infections, normal flora of the mouth, vaginal canal, and intestinal tract. It can cause thrush or vaginal infections. Let's see, and then there's mycotoxins. Please note that I am going in and I'm taking aspergillus and making it italics. That's important. You always underline or italicize genus species names. You always capitalize the genus name and lowercase the species name. If you don't, it's not correct. It's just one of my pet peeves. So mycotoxins is caused by Aspergillus flavus, and it killed 100,000 people in Turkey, and it's from contaminated peanut meal. But you hear of people, especially farmers, that are having to work with bags of seed and grain. If the seed gets wet and the fungus grows on the seed, then when they're pouring it, they're breathing in those spores. So if you have farmers in your family, and especially any of them that are getting older, that are diabetics or having other issues begin to show up, make them wear a mask. Whether it's a cheap paper mask or you buy them a real nice one, whenever they're working with fecal material, cleaning out chicken houses, or they're working with feed that has a lot of dust in it, they need to wear those masks.